Good evening, everyone. I am Dr. Yash Khanvilkar, MD Medicine, practicing at Baner. So, the primary practice in my cases include diabetic patients and hypertensive patients. So, diabetes, as you know, is a chronic, it's a non-communicable disease, which is a chronic disease, and it is mostly a lifestyle disorder. The recent news which we have seen, like on around almost 11% of young people are now suffering with diabetes. So the main symptoms which we include in diabetes are increase in the urination, increase in thirst, as well as generalized weakness and fatigueness. So most of the patients, that is 70% of the patients, don't even show any of such kind of diabetes symptoms which I just mentioned. So regular screening of diabetes is very very essential and very very important, so as to know and then further treat it properly. The treatment is primarily done by us, that is diabetologist and consultant physicians, as well as in severe and complicated cases it's done by endocrinologist as well. So for the diagnosis, we generally recommend doing three tests, that is fasting blood sugar, the postprandial blood sugar, and HbA1c. The fasting sugar is done after a period of 10 to 12 hours of fasting in the morning. The postprandial is after 2 hours post meal, and the HbA1c, that is done in the fasting state, helps us to know about the 3-month average sugar. If two out of these three tests come out of the normal range, then we consider diabetes to be present. That is fasting above 110 milligram per deciliter, the postprandial above 140 milligram per deciliter, and the random sugar also is done in some cases, which if it is about 200, then we recommend for these tests. The ranges of HbA1c, normal is below 5.7, 5.7 to 6.5 is pre-diabetic, above 6.5 is diabetic range. If two of these three tests come positive, then we recommend to consult a diabetologist and get yourself treated. The main treatment aspects, especially for pre-diabetic patients, goes with diet and lifestyle modifications, whereas for the full-blown diabetic patients, it goes in terms of treatment with medicines, that is drugs, that is oral hypoglycemic drugs as we call it, and in severe uncontrolled cases, insulin. Also in selected cases, that is the young people with diabetes, which we also know as type 1 diabetes, generally they are started initially on insulin because there is insulin deficiency in these patients, which is the main mechanism behind the diabetes. This diabetes treatment is very very important because so as to prevent the complications which are associated with it, which include affection of the eyes, that is known as diabetes retinopathy, also affection of kidney known as diabetic nephropathy, then affection of the heart, as well as vascular complications which are associated, and affection of the nerves which we know as diabetic neuropathy. So prompt management is very very essential. So the final message would be that diagnosis of diabetes, early detection of diabetes, screening of diabetes is very very important, so as to prevent the complications which are associated with it. So we would request everyone for the proper screening of diabetes, proper detection of the diabetes at regular intervals, at least once in a year, and to consult the physician diabetologist in case if the reports are abnormal. Thank you.